our next speaker. I'm so happy to introduce Dr. Megan Hope. If you were here for the last talk, you would have met Charlene, who's a doula, and together Charlene and I supported Megan in her pregnancy and with her birth, and she may or may not share anything about that, but it was a great honor and privilege to be able to do that, and it's a great honor and privilege to have you here with us today, Megan. A little bit about Megan is that she is a qualified chiropractor who received her master's degree from the University of Johannesburg. She's the owner of Atlantic Spine and Joint Health Center. After qualifying, Dr. Hope worked abroad for a Saudi Arabian Royal family as part of their multidisciplinary team, treating not only the family, but also numerous high-profile individuals from all over the world. With this global exposure, she had the benefit of working with some of the world's foremost doctors and specialists, gaining invaluable knowledge and expertise along the way. Proudly South African, in 2015, Dr. Hope returned to South Africa to share her passion and international knowledge for chiropractics, and in doing so, she took over, grew, and developed the dedicated team, which now forms Atlantic Spine and Joints. She's completed numerous courses in the United States, and she's got a special interest and expertise in treating women, children, and babies using the Webster technique. She's currently only one of 2 South African chiropractors certified in the technique by the International Chiropractic Pediatric Association. And she also practices advanced biostructural connection, ABC, and Kihara resistance stretching, a technique based on the US Olympic athletes. So Megan, I should have made you a co-host, which means that if you do have anything to screen share, you'll be able to do that. And once again, I just want to thank you so much for joining us here today.
Thank you for having me.
I'm going to stop my video and you can go ahead.
Okay. Let me just see. Sorry, I'm not great at the Zoom thing. There we go. Let me just adjust that. Okay. So thank you so much for having me. It's such an honor to chat to you about all things pregnancy and chiropractic related. I'm really excited to be here. And yeah, it's such a passion of mine to talk about this. And I love helping and empowering women during pregnancy, and yes, it's great to be here. So thank you so much for the introduction, the wonderful introduction, and for having me today.
So welcome and so lovely to have you.
Thank you. So I'm not sure if, like most people I speak to, don't really know too much about chiropractic in general, and a lot of the time I have pregnant moms coming to me for like the first time during pregnancy, and they're like, are you sure this is okay for me to do, you know? So let me just start by telling you a little bit about chiropractic. So chiropractic means done by hand, and it's basically, we're doctors that have studied for 7 years, and we assess, diagnose, and treat neuromusculoskeletal conditions. So basically what we do is we just make sure that the spine and the joints are all aligned, and we use specific techniques to do this. And basically what that does is it takes pressure off the nervous system and allows the body to function optimally. So most people go to chiropractors for back pain, headaches, neck, you know, that sort of thing, referral pain down their arms, sciatica. There's like a whole host of things that people come to or go to chiropractors for. Obviously during pregnancy, it's a different story. You know, most pregnant women that you speak to will have back pain at some point in their pregnancy. And it's one of those things where, you know, no one really has a pregnancy that's like they 100% okay. There's always an ache or a complaint here or there. And generally speaking, like chiropractors can help with a lot of these things. So what I specialize in is the Webster technique, which is a specialized chiropractic technique for pregnant women and babies. And this technique focuses on safe chiropractic care for the pregnant woman and baby. It's a lot more gentle than treating a big guy or your average patient, you've got to take into consideration a few things, obviously mom's growing belly, and any other underlying conditions that that patient might have. And yeah, so basically what we do is, well, what people come to chiropractors for as a pregnant person is often it's back pain or headaches. A lot of the time people have heard, okay, chiropractic is great for, great for just like a general checkup, or before I go into labor, it's good just to have a checkup and see that everything's okay. So yeah, so basically women come in and they will have a host of issues. So either it's like back pain, it might be round ligament pain. A lot of people get lightning crotch, which pubic symphysis dysfunction, and carpal tunnel syndrome, headaches. And a lot of the time these people these moms don't want to take medication. So chiropractic care is great in the sense that it's drug-free, it's conservative treatment, and it's safe, and it's very effective in helping a lot of these patients with their symptoms. So what I'll do is we'll assess the patients, we'll ensure that like her pelvis is moving correctly, the lower back is, there are no restrictions in her lower back, and her neck. We tend to focus on the rest and digest system. So it's the neck, lower back, and pelvis. And we just ensure that there are no restrictions there in the joints. So the joints are able to move correctly, and the pelvis and sacrum can move nicely. And this is great for, obviously, if you're planning on having a natural birth, it's really important that that pelvis can open up and your sacrum is moving properly. If, for instance, you have got a restriction in your pelvis and there is muscle tightness, associated muscle tightness or compensation going on, this can affect the uterus by creating what we call is intrauterine constraint. And what it is if you can imagine like a balloon, which is your uterus in the pelvis, and this uterus is obviously it's got strong ligaments that attach to it, and one of them is the round ligament. And the round ligament actually has smooth muscle cells in it, so it's able to contract. And this round ligament attaches to the pelvis. So if the pelvis is out of alignment, this ligament has the ability to contract, and it supports the uterus and prevents it from flopping backwards. So often what happens is when the pelvis is out of alignment, you get tight hip, you get associated muscle tightness in like the hip rotators, in the glutes, and it obviously affects these ligaments. And these ligaments pull on the uterus and can create intrauterine constraints. And how this affects the baby is that it can prevent the baby from moving into the correct position, and it basically creates a torsion on the uterus, and it can affect the baby's development in terms of, spacing and moving around and having that room and freedom to just grow and develop normally. So the Webster technique focuses on just correcting any of these like biomechanical restrictions in the pelvis and your lower back, as well as removing any sort of tension in the surrounding muscles of, like the hips, the glutes, and then removing any tension and tightness in these ligaments. And the idea is just to create more space for the baby to move and develop and grow. And obviously this is really important for breech presentations. So, a lot of the time, like moms come into the practice and they come in with a breech presentation, and usually this occurs, they find out at about like 34 weeks is the general rule of thumb, and they're now wanting a natural birth, And all of a sudden it's, they've got a breech baby and their gynaes are maybe speaking about a C-section or an ECV. And not many people know that you can actually go and see a chiropractor. And it's not to say that we treat breech presentations, because we don't treat the baby at all. All we do is we take away any sort of restrictions and muscle tightness, and we just allow the baby space. We take away that intrauterine constraint, and we just allow the baby space to move and grow and develop nicely. And more often than not, the babies do end up turning into the correct position. So research has shown that up to, or it's actually more than 82% of breech presentations turn into the correct position following the Webster technique, which is amazing. And, I wish more people knew about it. I actually had a chat when I was pregnant, and I chatted to my antenatal class and just about chiropractic care in general during pregnancy. And of course I mentioned it, but there was still that one that, I don't know if she was maybe on Zoom for that lesson, because it was during COVID or whatever. But yeah, I don't know if she was on or she just wasn't listening, but she ended up having a C-section for a breech presentation. And I thought, oh my gosh, I could have helped you, or at least tried to. But so it's great for that. And a lot of moms come in. So the types of, things that they come in for are for, breech presentations, pubic symphysis dysfunction, which is pain in and around the pubic bone. That usually indicates that the pelvis is out of alignment and needs to be adjusted. And, the movement there's not correct movement, and there's usually associated muscle pain. It's quite a debilitating condition as well, as a lot of moms will tell you. It's something that is pretty easily treated chiropractically. And then obviously also treating, headaches, neck pain, which is pretty common during pregnancy as well, due to the changing, women's changing posture. So what ends up happening is, as the mom starts putting on more and more weight and her tummy gets bigger, so her posture changes, her center of gravity shifts. It's no longer close to the spine, it's further out. And all of this affects posture. It affects the way the muscles work. Your muscles end up working differently, which is why a lot of moms get muscle pain, back pain. And this can all contribute to headaches, jaw pain, and just general tightness. So it's a great way to treat patients effectively and safely without the use of medication. I think every pregnant woman should go and see a chiropractor, because research has also shown that moms that receive regular chiropractic care during their pregnancy end up having shorter labor and shorter labor times. So in moms who are pregnant for the first time, who receive regular chiropractic care throughout their pregnancy, they end up having, on average, a 25% shorter labor and delivery time. In moms that have been pregnant numerous or a few times before, they end up having a 33% shorter labor and delivery time. And I mean, I don't know about you, but I would do anything to shave off some time from labor, and it's not many people know this either. So it's really important that you have regular treatment throughout your pregnancy, not just at the end when you start getting symptoms or you start having issues. Obviously, a lot of the restrictions, so for the moms that do come in at the end, or around 32 or 34 weeks, that's great. I mean, rather have a treatment than not have a treatment. But it is important to start off with a healthy musculoskeletal system where, you know, the joints are moving nicely, your nervous system is functioning optimally. And yeah, I think there are obviously, you know, moms wonder as well, like how do I know if I'm not allowed, or if I'm allowed to have a treatment or not allowed? You know, often they'll go to their gynaes, and most gynaes don't know too much about chiropractic care during pregnancy. Although I have spoken to quite a few of them, or I try and like let them know about the benefits of it. But yeah, like there are some instances where we would like maybe refer out to the gynae if we are, or if I am concerned that something is going on. So like in some cases we won't, or I won't treat, and that would usually be with more severe things. So it would be like if there's preeclampsia, so yeah, if they've got a really high blood pressure, and that needs to be seen to like immediately. There's also placenta previas, where obviously the placenta is covering the cervical opening, and you've got to be very careful with patients like that, or you know, where there's like bleeding or spotting, and yeah, we would have to just get them to chat to their gynae. And I would, you know, obviously we always take the safer route, and we would rather not treat. There are like the treatments itself is very gentle, so it's not like these massive adjustments and cavitations, which is what most people expect. But yeah, so we are very, very careful, like with moms that have underlying conditions. And yeah, so it's very rare though that we would actually like have a patient that that is unable to receive treatment. And we are like obviously chiropractors that are specialized in prenatal care, are really careful to pick up these red flags and to know when to refer out. So yeah, like we would rather refer out and make sure that everything is okay and get the okay from your gynae before treating. So we're not just like jumping blindly into treating every pregnant woman. We go through a whole screening, and we obviously do a full history taking, physical examination, and we make sure, you know, that the patient is okay to treat, and it's safe. Like like even with, you know, like preeclampsia and all of that, it doesn't occur that often. I mean, it does occur, but we keep an eye out for it. So I measure blood pressure each time or on each visit, and we monitor it. And yeah, it's chiropractic care is very safe. We keep an eye out for all those red flags. So yeah, so that's that. Let's see here. Okay. Okay, and let's see. Yeah, so yeah, there's no reason to not go for a chiropractic consult. I think, yeah, like a lot of moms come to receive or go for chiropractic treatments like as the first time while they're pregnant, and most people don't know what to expect. So usually what you can expect on the first visit is that you'll come in, we'll do a full history taking. So we'll check what your main complaint is, and we'll ask you questions around that. And then we will do, we'll ask about your family history as well. If there are any, like if there's a history of any strokes, high blood pressure, any other conditions that run in your family, cancers. We'll ask you about previous accidents, injuries, hospitalizations. We'll ask you about diet, exercise, which is really important during pregnancy, obviously. And yeah, like I actually pay special attention to diet and exercise during pregnancy, because it can make or break your pregnancy as well. I think a lot of moms tend to, your gynae say don't start anything new with like regards to exercise, which is true. And yeah, you want to be doing like, some form of light cardio exercise, gentle weights or light weights. You don't want to start anything new. Yoga is fantastic for pregnancy. And yeah, like also along with that, making sure that, at home they're eating correctly. So I usually refer them, or I recommend that my pregnant mommies use or read, it's Lily Nichols' Real Food for Pregnancy, which is a great resource. And all of this, and the hands-on treatment, all help moms have like a great pregnancy. Not everyone's going to have a great pregnancy, but yeah, it can help ease the symptoms of pregnancy. So yeah, I don't know if there are any questions or whatever, but yeah, so that's part of the history taking. We'll find out all about that. And then once we've done the history taking, we'll move on and I'll do an assessment. So I'll have a look, I'll get the mom standing and we'll have a look at where she's experiencing her pain or what her symptoms are, whether it's carpal tunnel syndrome or, like wrist pain, or if it's low back pain. I'll get her standing. She'll show me exactly where she's feeling the pain. We'll have a look at the area. And then I'll have a look at her posture. And from there, we'll do a physical examination, which includes blood pressure taking, and we'll get her to do general range of motion exercises. And then from there, we'll treat her. So most moms, they come in and they're actually quite surprised that they can just lie down on their tummies. So we get them lying on a beautiful, beautiful foam mattress, and it just supports the belly. So we put it on the bed, and it just supports their belly really nicely. So a lot of moms love lying on their tummy when they come in for a treatment. And so we start off with them on their tummy, and from there I'll start with my treatments, and we'll treat, like I said, lower back, pelvis, and the neck. So we're focusing on the rest and digest nervous system, which is the parasympathetic nervous system. And this is how it is different from treating normal patients, where I'll treat the whole spine. And, in some cases, like we will, if I do need to treat the sympathetic nervous system, we'll do it in a certain way. So it won't just be, I adjust the whole spine and that's it. There's a certain way that I would do it in order to not confuse the nervous system, but so that it promotes feelings of well-being and relaxing. Working on the parasympathetic nervous system does that. It's the rest and digest, and often after treatments, moms feel really relaxed and really sleepy, and they often have a very good night's sleep after the treatment. That's like they feel great afterwards. And it's normal for moms as well that maybe feel a little bit, of post-treatment soreness. Some moms do, but generally speaking, it disappears within like 24 hours. And that can just be because the joint has been stuck for long periods of time, or there's a lot of muscle tightness. I mean, we are working in areas where there is pain. So, and you go in and you maybe just like, you're adjusting, you're working on the muscles and the ligaments, and it might cause a little bit of post-treatment pain, but that usually disappears after 24 hours. And yeah, most women feel amazing after their treatment. Yeah, so that's what a chiropractic treatment involves. And then it's also, I think I forgot to mention as well, it's also great. So obviously for babies, positioning in utero. So it's, you know, chiropractic in general, like it's just helps reduce intrauterine constraints, and it allows for fetal well-being and also for optimal fetal positioning. So yeah, I spoke about this earlier with breech presentations, and also babies that are maybe not in a great position for birth. And, you know, moms come in and they're like, oh, my midwife sent me in, you know, like babies and, you know, posterior presentation, and, you know, I need to get baby to move, or, you know, so we just, like, I'll assess and treat the patients, and we'll adjust their pelvis. It always includes a pelvis adjustment if, especially if there is a restriction, and there usually is, because there's, I mean, with pregnant women, there's a lot of relaxin in their bodies. So that means that the joints are mobile, they're very mobile, and they tend to move out of alignment quite easily. The relaxin also means that the adjustments don't have to be hard. They're very gentle adjustments, and you don't need much force to get that joint to move or to correct the movements. And so we do that, and more often than not, you know, with home exercises, so whether it's the mile circuit or some of the spinning babies exercises, we are able to get the baby into a better position. And it's not that we do that, I mean, we just create space for the baby to move. So yeah, chiropractic can really help in terms of preventing cesarean sections in, you know, in patients where their babies are breech, because in South Africa, it means if your baby's breech, it's, you know, it's an automatic C-section. There's no trial of labor, there's no midwives, and gynaes tend to stay away from, you know, birthing babies in the breech position. I think in Europe, you can still find some midwives that do that, but unfortunately in South Africa and in Cape Town specifically, we don't have that option. So if your baby's breech, the chances are, you know, your gynae will be pushing for a C-section. Research has also shown that most babies can actually even turn up until 38, 39 weeks. So, you know, you've also got to give it time. From my personal experience and practice, what I've seen is, you know, it can take 4 to 5 treatments, but obviously the sooner mom comes in with a breech presentation, the better. So if they come in at 34 weeks, that's, you know, and it's their first time coming in, you know, we need that full amount of time. So the earlier they come in, the better. And we would need them to come in from, yeah, like 34 weeks right away as they find out. And we would use, I'm very much like open to treating with, in a like multidisciplinary setting. So I usually refer that patient to an acupuncturist as well as to a homeopath for pulsatilla. And there's a combination of treatments, a treatment protocol that we use for these breech babies or these breech presentations. And more often than not, the babies do turn. So yeah, it's at least, you know, research has shown like 82% of the breech presentations turn into the correct position following the Webster technique or the Webster adjustment. And a lot of that occurs only so some can occur immediately, and then most, it takes like at least like 4 to 6 treatments to see, because there's often a lot of like underlying muscle tightness, muscle stiffness that we need to address. It's not just adjusting and, you know, the body's ready. it's like an unwinding procedure where you've got to address, okay, it's, you know, the joints that are out of alignment, but there's a lot, you know, mom's had this joint out of her pelvis has been out of alignment since conception. Now you've got this, you know, muscle tightness that's been there for weeks and weeks and weeks. And it usually takes a few treatments to address everything and to get the body ready and to create space for the baby. But I have had patients where we have adjusted them, and it's usually in moms that have been pregnant before. So that's come in, and maybe it's like, I think it was actually her third baby. And this baby was breech. She had, yeah, obviously 2 other pregnancies before, both natural. And she came in and she was 37 weeks pregnant, 37 or 38 weeks pregnant. And her baby was breech. And she was obviously worried. She wanted a natural birth. And I treated her, and that evening she was busy cooking. So she was standing at the stove cooking. She bent down to pick something up from out of the cupboard, and she said she just felt this, like she had this back pain. And anyway, she went in to see her gynae the next day, and the baby had turned. So yeah, it was pretty incredible. And there was also, you know, it was literally right after the treatments. And so you do get some babies that it's the one thing they just need, and they just flip around like pretty soon, like within a day of treating. But there's some that take their time as well, that you need to do like extra work and just make sure, you know, that we've addressed like all the restrictions. I mean, it includes looking at like and assessing the diaphragm, because when you look at obviously like the pelvic or the abdominal area, you've got to make sure that there's no fascial or like fascial restrictions as well. So we look at, you know, making sure like the kidneys, there's movement in the kidneys. We look at the diaphragm. You know, often moms that, I mean, you should generally be able to fit a finger underneath your rib cage. And with some moms, you can hardly touch the skin and they are shrieking in pain. So that obviously means like we need to address that, because if you look at the diaphragm, it's a very important muscle in giving birth. And if there's tightness there, we need to address that. So it's not just about looking at the joints, it's also, you know, the rest of the body and looking at the body as a whole, and assessing. So your diaphragm works with your pelvic diaphragm at getting the baby out. And if there's any tightness or restrictions in these areas, it's going to affect, you know, the movement and the breathing and getting baby out. You know, obviously it's different if it's a C-section. I'm just talking natural birth now, but yeah, it's really important to make sure that we look at everything, and you can't do this all in one treatment. That's why it's really good to start seeing a chiropractor, like even before you find out you're pregnant, and get your body ready for like carrying this life and, you know, giving birth. So yeah, it's a great tool to have for pregnant moms. And yeah, I mean, obviously it was exactly last year this time I was getting ready to birth my little girl, and I had the wonderful Karen as my midwife at home. I had a hospital birth. It was yeah, I mean, I would have definitely been keen and up for a home birth, but it's because it was my first pregnancy. My husband wasn't too keen and doesn't know, you know, he was like, let's just go to the hospital. And, you know, like we chatted about it and I was happy to do that. But, you know, I still wanted my home birth, and we kind of got to you know, an agreement where I said, okay, as long as I have a midwife at home that can monitor me, and I want a doula. I had the full team. I had a midwife, a doula, and a gynae. I had the wonderful Charlene as my doula. She was amazing, and I actually did the hypnobirthing course through Charlene, as well as the the podcasts through the Virtual Midwife and Karen, which were very enlightening. And even as a medical professional, it took me from being a little bit scared and apprehensive about birth to being like, wow, like, okay, I'm actually interested to see how all of this is going to feel and pan out. And it took me out of that fear-based, around birth, because even though, like, I know about pregnancy and all of that, you still have these worries and like, what if, and what if my baby's breech? I still have those worries as well. And my gynae was like, well, you just got to go and see a chiropractor then. But so yeah, it was great to have those resources from Karen and Charlene. And I went into labor it was about 1 o'clock in the morning, and I was like, I'm not sure if, what's going on, but I felt like period pain, and I was like, okay, is this it, Anyways, progress throughout the night, and I went back to bed. My husband's like, go to sleep, you'll be all right. And yeah, by like 6 o'clock that morning, I knew I was in labor, and I was like, okay, the baby's definitely coming today. And firstly, I must tell you that my due date was actually on Christmas Day. So I was just like, this baby cannot come on Christmas Day. So there was stress around that as well. Like, and I was just like, it can't come on Christmas Day, babies, I know there's an increase in cesarean sections between Christmas and New Year. And that's why I made the decision to have Karen at home with me. And to labor at home for as long as possible. So what I think Karen and Charlene came, my doula and midwife came at around, it was 10, 11 o'clock in the morning, after being in labor for 10, 11 hours. And my baby was actually in the posterior position for the last 6, 7 weeks of my pregnancy. And I was just like, as a chiropractor, I know it's not the best positioning for baby, but I had been treated throughout my pregnancy and, with chiropractic, and I had acupuncture, I was eating well, exercising, and this baby just wouldn't budge. And it was actually stressing me out at the end, along with when is baby coming? Is baby going to arrive on Christmas Day? Anyways, after a long, heart-to-heart talk with Karen, she's like, just let it go. Trust your body and your baby, and that, they know what to do. And there's, you've done everything, just relax, enjoy this last bit of pregnancy. And as soon as I put my mind, at ease, and I just decided not to worry about it, I ended up, obviously I was, still, worried, babies, in a posterior presentation usually can have facial damage coming out if you're wanting to birth vaginally. And it sometimes ends up in a C-section. With this specific presentation, they stargazing. And by miracle, I ended up, so I was laboring. Karen came around at around 11 o'clock, and I had them there. She checked for, how far dilated I was. And it was so funny because I was following an app on my phone that said, it measures your contractions out, and it's tells you when to go to the hospital. And this app was telling me at 11 o'clock in the morning to go to hospital. And I was about 5 centimeters dilated, I think. We had checked. I was it was even less. It was 4 centimeters. And anyways, and I was like, there's no ways I'm going to hospital now. This baby's doesn't feel like it's coming anytime soon. Anyways, had a bath, listened to my hypnobirthing, did all of that. And I ended up only going to the hospital I think Karen checked me at 3 o'clock in the afternoon. And by that stage, I was 6 centimeters dilated. Climbed in the bath again for a short while. And then I was like, I'm ready to go to the hospital. I need some pain medication. I can't do this. And I remember Karen saying to me, you need to make sure that you reframe the word pain. And I was just like, how? It's just felt like period pain, and I was just like, okay. But also knowing that I was going to the hospital and that pain medication would be available, I think eased my anxiety. And like, I was like, okay, let's do this. Let's just go. The drive to the hospital was very interesting. My husband, literally every time I had a contraction in the car, I was like, stop the car. And I'd have the contraction and we'd drive. Thankfully, it was like a Sunday afternoon, so there weren't many cars on the road. But it was an interesting drive, to say the least. Got to the hospital and, checked in and all of that. And by the time that I was in the room and the midwife at the hospital was checking me, she, obviously thought, I didn't think she realized how far along I was. And she was like, okay, no worries, just stand on the scale. We just need to measure your weight and measure how tall you are. And I'm like, just get me, like, I can't do this. I ended up telling her like random numbers. And anyways, got to the room and she checked me and I was 8 centimeters dilated, and I heard all the bells go off and, the alarms go off, and next thing you know, gynae's there. I had some gas, which really helped with my pain. So they gave me the gas at 8 centimeters. And for the last 2 centimeters, it really took the edge off. And yeah, Charlene was there the whole time. And it was just incredible to have someone like that support system there. My husband was there as well. And it was amazing. I think I always tell Charlene she like massaged my baby out of me. But she was just massaging me, and the other midwife was there and she was also amazing. And literally, I arrived at the hospital at 3:30. By 5:30, my baby was born. And unfortunately, we had a bit of a complication because my husband ended up testing positive for COVID after I had given birth. So, like, in a way, it was a blessing to stay at home for as long as possible and labor for as long as possible, because by the time I got to the hospital, there was no time to do a COVID test. And he had no symptoms. We had self-isolated for 10 days before the baby arrived. So I'm pretty sure it was like a false negative or a false positive test. But, had we gone to the hospital too early and they had checked us or they had tested us, he wouldn't have been allowed in, and nor would my doula, because we had all been in contact at home. So I would have had to labor and have the baby by myself, which, I look back and I'm like, I take my hat off to moms giving birth now during this period, because it is hard and you need that support system around you. Ended up having my baby at 5:30, and it was a beautiful baby girl. We called her Olivia, and she had her adjustment right after she was born, her first adjustment. Obviously, being a chiropractor, made sure that she was adjusted, as within the first few hours of being born. And it was just, that was my story. But what was so nice was that I was always so worried about my baby's positioning and her being a posterior presentation, but she was actually born in the best position possible. So she was born in an occiput anterior position, and she came out like beautifully. There was, all that worry and stress, and Karen was right. You just have to listen to your body, or trust your body and your baby, that they know what to do, and they do. So she managed to turn 180 degrees during labor, and she birthed in the best presentation possible. And this obviously, it goes back, and I'm sure it's got to do with having a healthy musculoskeletal system, and exercising, receiving regular treatments, and being very in touch with my body and my baby. And it was also, there was that aspect of just letting go. It's that's my story. And I was lucky to receive chiro treatments. The chiros treat each other, and I was lucky to receive chiropractic treatment throughout my pregnancy. I had a wonderful pregnancy. I was really, really lucky. And, you know, I wish that all moms could have this as well. And, you know, there are going to be, you know, struggles and that, but there are people to help you, and, you know, people with resources that know what to do and can refer you in the right direction. So, yeah, it's sometimes just about reaching out. And yeah. Okay. I see there's a question here from Sarah. How would you address tightness in the diaphragm? So what we would do is we would check. So firstly, with addressing tightness in the diaphragm, is I would actually put my fingers underneath the mom's rib cage. We'd have her lying on her back, and I'd actually put my fingers underneath her rib cage and just check for tightness. So some moms, you can usually fit like a whole thumb underneath there. It also depends on how far along they are and how high the baby is. But generally speaking, you should be able to fit like a finger or a thumb underneath your diaphragm or underneath your rib cage. And then there we can assess like the muscular tension and tightness in the diaphragm. Some moms can hardly bear being touched like in that area because it's so sore. And then you know that there's like tightness, and you know we need to work on that area. And I would do gentle mobilizations into that muscle along with breathing. So we'd get them to breathe in, and I'd go in and breathe out, and we'd slowly loosen and work the diaphragm all along on the right and left hand side. By the way, this is actually really, really good if moms are suffering from reflux or heartburn. So if your diaphragm is tight, it can obviously pull. If it's tight on one side or the other, it can pull the esophagus over, and that can cause reflux. And it's actually the same in babies as well. If you have a refluxy baby, that's one of the things we look at is the diaphragm. And yeah, so we mobilize the diaphragm, make sure that we take away any tightness, and it's actually really interesting is that, you know, with that, you've got to look at like the kidneys as well, and making sure that the kidney movements on either side is good. If we struggle to release the diaphragm, I usually have a look at the kidneys as well, and we mobilize the kidneys. And that's usually with the whole fascial system, it provides a lot of relief, and it you just get a lot more what is the word I'm looking for? You can just like freedom of movement, if I can say that. And you know, obviously babies squashing everything and whatever, but it just opens up the area really nicely. And we do the kidney release side lying, and that usually works in combination with the diaphragm release. If we're struggling to release the diaphragm. So yeah, and then I often get moms at home to focus on diaphragmatic work, so breathing and making sure that, you know, I get them to put their hands on their belly, and you get them to do breathing exercises. So one hand is above the belly button, and the other hand we tell them to put below the belly button. And I get them to breathe into the hand that's below the belly button. So basically you want your breath to be nice and deep. So you don't want shallow lung breathing, you want belly breathing. And this is the breathing that you're going to use during labor and to get the baby out. And it's the diaphragm and your pelvic diaphragm that are working together, almost like syncing like this, to get the baby out. Now, obviously, if there's tightness in one or more of the diaphragms, it's not going to be as effective. So yeah, we just we check that, and yeah, the diaphragm breathing and the abdominal breathing are just really nice exercises that we get for the moms to do at home, and they need to really breathe into that lower hand, and the breath needs to reach the pelvic diaphragm basically. So yeah, it's just a really nice way to get moms used to like breathing correctly during labor, because that's what's going to help baby to get out. So yeah, I hope I answered your question there, Sarah.
Thank you so much, Megan. That's been absolutely amazing. It's just so good to get your expertise. Thank you also for sharing your birth story. That was really beautiful. And I think it was a lovely way of also pulling it all together and sharing it from your own perspective. It makes such a difference. And once again, it was such a privilege and honor to be with you in that journey. And there were some questions around that. You're so welcome. It's just.
I've always said my next birth. I've told my husband already. My next birth is going to be a home birth, and he needs to make peace with it. Yeah, I just realized, if you can do it at the hospital, you can do it at home. And like, I just found the hospital birth to be. I mean, it was great, but it's not an environment for healing, I think. And there were so many interruptions after giving birth. Like, you can't rest. Like, you've got someone cleaning the bin at 2 o'clock in the morning and waking you up. Do you know what I mean? So, yeah, and checking your blood pressure and so yeah. I mean,
we all have the same team.
Absolutely. So my sister-in-law is currently pregnant now, and I think she's taking the same route as I am. She's like, I want that, So yeah.
And I love also what you say about the diaphragms, about the pelvic diaphragm and that need to be working together.
Yeah.
And also about how much it's just about creating space. So so many of the things that you brought up, there was so much in that needs to kind of be unpacked. But that makes such a big difference. Also, the importance of diet and exercise, so that we're looking at that. And I also do definitely recommend the Lily Nichols book. And her prenatal nutrition. And in the Due Date Club, actually, we have a monthly book club. And last month, our book of the month was The Real Food for Pregnancy, which was really
awesome. I think I've read the book like 2 or 3 times. It's just so full of great information and research, and
can't get enough of
really
it.
Great.
And it's really, really a great resource. And then the other thing, also when we're talking about space, about the importance of understanding the hard structures and the soft structures. So you've got, your bony pelvis and the joints, but then you've also got the ligaments and how those work together, and about and working with that hormone relaxin, and then positioning to create space for the baby to change position, and understanding optimal fetal positioning. So yes, a lot of insight for the moms. And thank you so much for sharing so beautifully.
Thank you so much for having me.
I don't know if there's any other questions from anybody. We've got another 5 minutes to take questions if there are, before I start preparing for our next talk. And our next talk is about partner support. And I'm loving the way it's all come together, actually, because every talk is kind of built on the one before. We started with Tracy talking about sleep and understanding infant sleep. And then we went on to Victoria, which we talked about physical preparation and fitness and health, and the importance of being, building your strength and your stamina, toning the body during pregnancy, and of how to work with your body after the baby's born, which is your physical preparation. Then we had Charlene talking about the mental preparation. And then you coming in and talking about balance. So it's just been wonderful, wonderful, wonderful. Now we're going to go on and listen to Esther Jones, who's going to be talking about partners in the birthing space and the dad's role, if it is a dad, whatever partner you have coming in with you, and how they can be the best support for you. Just checking to see if there's any other questions as we do that. Not yet.
And then I actually forgot, I totally forgot to mention that there's a giveaway, right?
Oh, yes.
So you asked me to mention it at the beginning, and I completely forgot. Sorry.
Oh, that's okay.
But so I'm giving away a free chiropractic treatment to one of the participants here. And if you can answer the question correctly, or you're the first person to answer the question correctly, then you win the prize. So the question to everyone out there is, what is the technique? What is the specialized chiropractic technique I use to treat pregnant women?
On your marks, get set.
Set.
Cara!
Yes, well done, Cara, the Webster technique. So well done to you. You win a free chiropractic treatment. And yeah, you're welcome to get in touch with me or Karen, and we will organize it.
I hope you're in Cape Town, Cara.
Yeah. Where are you from, Cara?
Yes, she is.
Okay, great.
Sorry, you can't see me. My light's terrible.
There you are. Congratulations.
Nice to meet you, Cara. That's fantastic.
Yes. You too.
When is your baby due?
I had a miscarriage earlier this year, so I'm pregnant now. So probably in about July.
Oh, lovely and early.
Next, appointment next week. So we'll see. Hopefully everything's okay.
Perfect. Yeah. I look forward to meeting you.
Yeah. Thank you.
It's lovely that you're here in early pregnancy to get that support that you need. And I'm glad that you joined us. Thank you so much.
Thank you.
And I think you've been at quite a few of the sessions. So you're obviously enjoying all this lovely information.